younger women are being diagnosed with breast cancer here in Utah. That's the findings from the Breast Care Center at Intermountain Medical Center. Women with family history need to get mammograms much earlier, and doctors at IMC say any woman, regardless of age, who discovers a lump, discharge, or pain should see a doctor about those symptoms. Today, we introduce you to one woman who did not wait until it was too late.
My family has a strong history of breast cancers.
And a strong history of survivors. And now Robin Sellars can add her name to the list of warriors.
You always think it's not going to happen to me. You know, I'm going to be the one that didn't get it, right?
But she did. Robin started getting mammograms at age 32, 8 years earlier than the recommended 40 years old. And just after her 40th.
This is a fairly large area.
So this is actually...
It is several areas of calcifications in her breast, described as DCSI.
And that is ductal carcinoma in situ, and that has the best prognosis.
Intermountain Medical Center Imaging Director for Breast Services, Dr. Parkinson, says that means the cancer is still confined in the milk duct and hasn't spread to the breast tissue.
We are looking at a fairly large area of calcifications, and that's why they recommended that that whole area come out.
Sellars had a mastectomy and is now undergoing reconstruction surgery, but she considers herself lucky because she didn't undergo chemotherapy or radiation. Despite her good news, Dr. Parkinson reveals troubling findings.
We had an unusual number of women under 40. About 20% of our breast cancers are between the ages of 40 and 50, and this year we've diagnosed several women in their 30s and some even in their 20s.
He says misleading recent articles may deter younger women from getting checked out.
There is no scientific evidence that cancers will disappear or regress.
And don't think you're exempt because you don't have a family history.
75% of the women we diagnose have no known risk factors. So if we only screened the women that were high risk, we would miss 75% of the cancers.
Robin reluctantly had a mastectomy, but now she's pleased she did because it means precious time with her growing family.
They actually had found another area on the opposite side of the breast that was just starting, and had I not gotten a mastectomy, I would have been back.
Well, Robin will need to get a mammogram every year from here on out. And although the recommended age is for women to start getting mammograms at 40, Dr. Parkinson says women should be breast aware at age 20. So that means paying attention to lumps, changes, discharge, or pain in your breast.